Hi, this is Dr. Cheryl Kemerer from Warrenton Pediatrics in Warrenton, Virginia, and today I'm going to talk about some basics about breastfeeding. Everybody has heard the phrase breast is best when it comes to feeding your baby, and there are lots of great benefits to breastfeeding. The obvious one is that breast milk is the perfect nutritional source for an infant, provides all the electrolytes, calories, fluids, and energy that your baby needs to grow adequately. The other great thing about breast milk is that it changes over time as your baby's needs change. So it's the perfect food for your baby. Some other benefits, there are immediate medical benefits to your baby. Breast milk contains a specific type of antibody called secretory IgA. That's important because it provides an extra protective layer of immunity to your baby's digestive tract, upper respiratory tract as well. This helps to decrease the risk of gastroenteritis, which are stomach bugs, upper respiratory infections, ear infections, lower respiratory infections while you're actively breastfeeding. There are also many studies that show long-term benefits of breast milk for your baby. These include decreased risks of certain childhood cancers, decreased risk of allergies, decreased risk of inflammatory bowel disease. There's also been a lot of research that has indicated a decreased risk of SIDS with breast milk. There are also a lot of both short-term and long-term benefits for a mom who is breastfeeding. Short-term, the risk of postpartum depression is decreased when you're breastfeeding. This is because of the chemical oxytocin, which allows your milk production and your milk letdown. This is also known as kind of like a feel-good or happy chemical. The same chemical your body makes when you fall in love with somebody, which is very appropriate as you are learning to love your baby. Moms also have reduced long-term risk of both breast and ovarian cancer when they have breastfeed, ideally for a full year, but any amount of breastfeeding is beneficial. Although breastfeeding is very natural, it's not always easy for some moms. Some moms do struggle, especially initially, and sometimes the struggles are more related to unrealistic expectations and not really knowing what to expect than true physical struggles. A lot of moms then further feel guilty that they're struggling. They may not really enjoy the feeling of breastfeeding. That makes them kind of feel bad. But rest assured that this is very common. The majority of new moms have concerns when it comes to breastfeeding. There's no shame in this, and there's always help available. So remember that breastfeeding is really one of the best ways that you can start your journey for your baby, and your pediatrician is a great resource for resources to make this journey successful. Thank you, and I'm Dr. Cheryl Kemerer from Warrenton Pediatrics.